So continuing on with our first video, we're now going to be looking at the arterial system, starting where we left off at our aortic base. Okay, so the first organ to receive oxygenated blood from the heart is the heart itself, actually. Here we have our right coronary artery and our left coronary artery. Okay, so these feed oxygenated blood to the heart, so we can continue to pump blood. And then just after the base of the artery, we have the aortic arch. You'll notice three branches here. These three branches we'll talk about in the third video. So following the aortic arch, we have the descending aorta. This is the thoracic portion of this aorta, and it lies just posterior to the heart itself, in between the heart and the spine. You'll notice that the descending aorta has other arteries that are coming out of it. These are the intercostal arteries. These feed blood to the muscles that are in between the ribs. And this goes from T3 to T10. And just inferior to our thoracic portion, we have the descending aorta, the abdominal portion. So this is the abdominal portion of the descending aorta. And as you can see, it's quite convoluted. So I'm going to remove some of the organs from this. We're not going to highlight all of them, but we will do some. So I'll remove the stomach, and just posterior to the stomach, the pancreas. So as I proceed down to the abdominal aorta, one of the first main arteries that I'm going to hit is what's called the celiac trunk. And from this celiac trunk, which protrudes out from the descending aorta on the anterior surface, this splits into two arteries. First, you have your common hepatic. Okay, so this is your hepatic artery, the one that feeds your liver. And then just to the left of that, the left divide, is our splenic artery, and that feeds our spleen with blood. Okay, so also on the anterior surface of the aorta, we have the superior mesenteric. So I've highlighted the superior mesenteric artery. This artery feeds blood to your large colon and your intestines, which I don't have shown here, but I do have this portion highlighted, so you can see how how extensive this artery is and how much it feeds your abdomen. Okay, so it's quite an extensive artery. So this is the superior the superior mesenteric artery, which by its name you can kind of guess that there's another mesenteric artery, which is the inferior. And I'll actually point that one out right there. That's your inferior mesenteric artery. And that one feeds your descending colon, okay, which is right before it ends up in your rectum and you defecate out your waste products, your food. Okay, so again, this is your superior mesenteric. Okay, and if you kind of get a closer look, let's get a closer look at that superior mesenteric. So let's zoom in on that superior mesenteric artery. Okay, so again, notice that it's on the it comes out of the anterior surface of the descending aorta, and just lateral or just infralateral to this artery right here, we have on our left side, we have our renal artery, which supplies blood to our kidneys. Okay, so I have my left renal artery and I have my right renal artery. So I've removed the anterior portion of the kidney on my left kidney, so you can see how the renal artery runs through the kidney. So just in case I show you a diagram and I want you to identify the renal kidney, you should know this general loopy shape that the arteries have as they run inside of the kidneys. Okay, and these loops, if you will, these run these run through the nephrons, which would be discussed in a later video when we talk about urinary filtration. Okay, so again, this is our mesenteric, our superior mesenteric artery, and just below that mesenteric artery and lateral to it, you have your renal arteries. So moving on from my renal arteries, I'm going to make my way down further from the descending aorta of the abdominal region, and I've actually already discussed the next one that I would point out, which is the most inferior of the arteries that we'll be discussing. Let me hide your superior mesenteric right quick, and we want to show your inferior mesenteric artery. Okay, so I've already shown you how which part of the body this feeds. So just below the inferior mesenteric artery, which we'll remove, you have what's called your common iliac. Okay, so the common iliac is called that because it has the iliac, the external iliac and internal iliac have this particular artery in common. Okay, so the common iliac divides into two branches. You have the smaller branch, the internal iliac. Okay, this internal iliac artery feeds your the posterior side of the pelvic girdle. Okay, and also your glutes. And then the internal iliac is the larger of the two. Okay, it's the larger of the two, and it also will run down and eventually become your femoral artery. Okay, so the femoral artery runs down along your, of course, your femur. Okay, and as it comes down along your femur and it feeds blood to your gluteus, your hamstring groups and your quadriceps group, it wraps around the knee. Okay, let's get a better view of this. It wraps around the knee on the posterior end, okay, and it goes behind the knee, and this part of the artery is the popliteal artery, okay, and this is your right popliteal and your left. Okay, and this particular groove that it runs in, down posterior to the knee is called the interosseous condyles. It makes sense actually if you think about it, because if that artery were to run on the anterior aspect, you have your kneecap there, and every time you bent your knee, you would cut off circulation to that particular, or at that particular artery. So as it runs down the posterior side of the leg, the popliteal artery will run continuously and become your posterior tibial. Okay, so here's your tibia, and it runs on the posterior end. And then just lateral to that, alongside your fibula, you have your fibular artery. Okay? So I'm going to wrap this now around to the anterior portion of the tibia and fibula, and you have your anterior tibial artery. Okay, so that does it for your arteries. Again, we did not touch on every single one, but for the most part, we've covered the major ones. And good luck in your studying.